Professional Reasoning presentation by Elena Dunleavy. I am 8 weeks into my fieldwork with Select Physical Therapy and Outpatient Hands at Grandview, Missouri, and I'm loving it. There is currently only one OT and one other PT with some PRN PTs that come in every once in a while. The OT is my CI, which is Rachel Allegri, and she is a certified hand therapist. We currently are seeing patients 7 to 5 each day, except for Fridays. We see patients 7 to 12, and we see many different diagnoses, including shoulders, elbows, wrists, hands, and fingers. And we can see patients with going towards the conservative route, which is before surgery or post-operative conditions. The patient I chose to speak upon is a machinist with job duties of constant pushing and pulling materials through his entire workday within the machine with constant reaching, and his first language is Korean, and his spouse and children at home are also Korean, and so English is a second language to him. He experienced a torn rotator cuff from the overuse of his job and everyday activities and decided to move forward with a surgical repair prior to seeing us at Select. He is unable to work due to the contraindications and restrictions from the surgery, and his job does not offer modifications, and so he is unable to lift his children, do daily chores due to the restrictions. Like I said, he and his spouse are from Korea, and that is their first language. So being patient and asking many follow-up questions and having some pretty basic questions that they can understand while using visual pain scales so that way he can just point to where his pain level is at have been super helpful for our communication. And I try to relate with our patient as I had the same surgery as him, and so he comes to me with questions and his concerns, and I just kind of have that conversation with him on my experience, and so we can kind of relate to things together. He is in increased pain, and he does not follow protocol as well as he should within his own home and outside of treatment, and so we use modalities to help relieve that pain, including e-stim, heat and ice, manual therapies such as massage and scar tissue work, and he has expressed to us that is helpful and has decreased the pain, especially ice post-treatment. Sleep has been a main issue for him as he does not perform the best sleep posture with pillows and sleeping on his back or in a recliner. Pretty much every treatment, we are educating him on the use of pillows and where to put the pillows and how to position his arm and shoulder to give him more relief overnight as he wakes up with the most pain, which sometimes gets about an 8 out of 10. Rotator cuff injuries and tears are most common in middle-aged men and from repetitive movements such as lifting, pushing, and pulling, reaching constantly, and some common impairments loss of strength and range of motion and increased pain with activities, and then after surgery, the contraindications and properly going through the protocol is the most important part of this surgery. Some occupational performance problems that could occur in the future is with his job as a machinist within those using those repetitive movements and heavier lifting kind of every day if we are not able to progress through the protocol with his increased pain and increase his strength as quickly as we would like. So carrying heavy loads away from the body or poor body mechanics when lifting and doing his job could be a performance problem in the future if he is not properly educated, and we are going to do our best to give him that. And then factors contributing to the problem are guarding of the shoulder, increased pain, him not following the protocol outside of treatments, including performing chores at home, doing the dishes, cleaning, doing all of that, lifting heavy, and he never used his sling really before, like during the 4 to 6 weeks that he was supposed to. He was rarely using that sling. Each evaluation, we go through an intensive interview to get important details of work duties and what is required of him to get back to work and his daily activities within the home that is needed of him with children, chores, just doing everything he needs to and wants to do. And then we take some measurements and then we go right into our treatment session. This patient was referred to us from a surgeon post-operation with the orders of 3 times per week and the protocol we are supposed to follow, and we provide a home exercise program based off his abilities and what he needs to be doing at home to improve his pain levels and his range of motion, his passive range of motion to begin with, and now active range of motion. Within our clinic, we have a big gym space, and with all the equipment you can think of, with weight machines, pulleys, TheraBands, range of motion tools, free weights, balance equipment, and within Handland, as they call it, we have cabinets full of fun equipment, including flex bars, TheraPutty, TheraBands, kind of anything and everything you can think of. Our patient and his spouse have both mentioned that the cost is concerning as he is not currently working right now, but will do anything to decrease that pain and get better so that way he can get back to work as soon as possible. So we are doing our best to decrease that pain, increase that range of motion and strength now that we just progressed him to start on strengthening per the protocol. Our documentation is fairly easy to use once you use it for a little while and get to know it, know all the different drop downs where everything is at. And so we do some multitasking when we see the patient as we are documenting everything that we are doing. And so the planning process is super important, so we know exactly what we're going to do each session prior to the patient showing up. And it is important to not overbook ourselves so that way we can be one-on-one with our patient. And like I said, that planning ahead of time is important so that way we know exactly what we will be doing so we can use as much of our resources as we can within that hour of seeing him. Rachel, my CI, and I have heavily valued communication through our action plan for our patient, coming up with different ideas and running my ideas through her and just talking things out and communicating. We have severely valued that within my time there, and that has been super helpful and proves to be beneficial to our patients. It has been important for us to progress him through the protocol, as getting back to work as quickly as possible is super important to our patient. A barrier with him being so motivated to get back to work so quickly is that he is not following the protocol as best as he should outside of treatment and at home, and is doing things like chores, doing the dishes, cleaning. And during the first 4 to 6 weeks post-surgery, he was rarely using that sling when it was required of him for the proper recovery, and sleeping on his surgical side has been an issue. He wants to decrease his pain, so we are educating him almost every treatment and his spouse when she comes in to trust the protocol, and just really educating them on the sleep posture and doing everything that they can do at home and not pushing it at home, doing chores, doing all of that stuff. And so the communication between us and our patient and his spouse have been the main priority. We have many goals for our patient, including short-term and long-term goals for both range of motion, strength, and decreasing pain levels. The short-term goal that I chose to highlight is decrease a current and constant 6 out of 10 pain intensity to 3 out of 10 intensity with activities within 3 weeks. The long-term goal I chose to highlight was to improve functional active range of motion in all direction, flexion, abduction, external rotation within 5 degrees from the bilateral side in 8 weeks. Thank you for listening to my professional reasoning presentation.